everybody, and welcome to the Dr. Whisperer Show. I have with me today orthopedic surgeon extraordinaire. Don't judge him because he's from Kentucky, Dr. Jason Hunt. And that's just a dig. I mean, I love
Don't
Kentucky.
judge her because she's from New York. So we're
Right.
all in
Yes,
Tampa. We're all in Florida now.
right. Right. So, Dr. Hunt, it's really good to have you. You were on the show mid-pandemic. I don't know. We were talking a lot more about really the focus was on the pandemic and what was happening and getting lots of healers to jump in and talk about what we could do to be a resource, which we still want to do, of course, always. But Dr. Jason Hunt has been up to some things that I'm super curious about. So we're all going to learn about it together here today. And before we get started, there's only one orthopedic surgeon I recommend to, and it is Dr. Jason Hunt. So he is not paying me to say that.
Yeah, that's not even a paid advertisement, but it
That is
sounded just
not,
like one. So
but it is true. Any time that anybody asks me, now knowing that you're in Pinellas County, whew, that's phenomenal. Love that. In St. Pete, we're going to hear about that location too. But I've always been an advocate for you as a human and then you as a doctor. And to me, that makes a very dangerously good combination. So, with all that said, all that niceness, no more. Welcome to the show.
well, thanks. That's too kind, but I appreciate it. We are hopefully pivoting away from all the conversation we had
Yes.
before about how do you survive in a pandemic, and hopefully we can see the other end of it and find our new normal. It's not going to be like it used to be, that's for sure. And I don't think that's all bad though. So
I don't
hopefully
think
we'll chat
so.
about that a little bit today.
Yes, I don't ever want to go back to whatever that was, that mess of a world that we were living in not so long ago. So my parents are on their way right now to get their second vaccine. So,
Nice.
things are looking up, right? So let's
Yeah,
see.
for sure.
All right, I got a bunch of questions for you, Dr. Hunt. You, when we met, you opened your first location, OrthoLinks, up in, what I used to say, East Bum Bubble, right near USF. I told you every time I drove there that I had jet lag because I am in Pinellas County, and now you have spread your wings so far that I can't even keep up with you. So tell us about the latest adventures with opening up St. Pete, opening up in Kentucky, and
Yeah.
and, and
Um,
and more. I'm sure there's a lot more.
there is. So the St. Pete, we had always had a business model to have a triangle of clinics inside of the Tampa Bay area. And when COVID hit, it really put that on speed dial. We had to do something to respond to, from a business standpoint. If you shut down elective surgery for 6 weeks, and then I ended up with COVID, so I'm quarantined for 2 weeks. We really had to pivot pretty fast and make a game plan, and it really sped up our. I think we probably could have been a little more aggressive early, but COVID really forced that, and we had to do something in order. Really, initially, it was just a financial response to what was happening. We needed to get more patients and have exposure to more people in order to continue to thrive as a business. So it really sped that up. And then I was lucky enough that the stars aligned pretty fast to find our new physician, Dr. Ranellis. So she was kind of looking a little bit, and I really, not to plug LinkedIn, but I posted on LinkedIn in like 6 minutes. She's responding, and it really was a great match really early. So,
There's nothing wrong
uh,
with plugging LinkedIn. It's only the second biggest platform for organic reach. Dare I say,
yeah,
somebody who owns a
yeah,
social media company, that really works. So good for you.
yeah. So it really worked for us, and it was just a freak deal where I hadn't planned on posting on LinkedIn. I was on another service, but I got this email, hey, post your free job, we'll boost it for a day. And then it only took a day to find Dr. Ranellis. So thank God for that. And so she started now in January, started the 1st of January. Has been here a month, and we're really trying to get our feet on the ground and expand in a new clinic. So in order to do that, we went to a new market. So you know how painful it is for people in Pinellas to drive to Fletcher, and it just, to be honest, it just doesn't happen unless they're really needing our services. And so we started in Central Avenue and in St. Pete, and we started just one day a week there to start to grow the business, and really trying to get out the word that there's a new option on that side of the bay. Same level of care, same philosophy that we've always had. Nothing's changed from that standpoint. We're always going to be the same to the core. We're just expanding out to a different market and trying to provide those same services to the people of Pinellas County now. And then
Right.
kind
Well,
of
let's stay on St. Pete for a minute. Let's just
okay.
for a second. So you're on Central Avenue, which is like, the hub of all the great food and all the great art and now all the great doctors, right? So a lot of people, once I told them that you were in Tampa, and then I would go like next to stuff kind of Tampa, they, were always asking me for another option. So really, really happy that you're open in St. Pete at least one day a week. And what day of the week is that?
It's on Fridays.
Friday.
So we're there every Friday.
Okay, great. And are you going there or is it just your new physician?
It's both of us right now. So Dr. Ranellis and myself, we're kind of spending some time together in all the clinics to kind of not necessarily just spread culture, but also just make sure that we end up on the same page. Because when we started with the model that we had of having a non-operative doc kind of be the hub of the clinic, we want to make sure that everybody understands it's not that you're not seeing Dr. Hunt or seeing OrthoLinks. It's that we work on a team together. So to be honest, it's like you add a new member to your team, and we spend some time figuring out how those personalities match, but also how we work best together as a team to make sure that the same level of care that you get in Fletcher becomes the exact same level of care that you get in St. Pete.
Awesome. I can't wait to visit your new spot. All right. So let's talk about Kentucky. How did that happen?
Yeah,
I can't even believe it, actually.
you can believe it. We talked about it for a long time.
Yeah, you can't go back. We're not going to let
Yeah,
you.
there's no plans to do that. But what happened is, and we've been anticipating this day for a very long time, but January 1st, there was an executive order that came in order that hospitals ended up having to post their prices online. And then the way that works is they had to post 30 of the prices that CMS required, and then 70 other shoppable items that patients can look at. And that can be something as simple as a lab test, anything the hospital wanted to post, they were allowed to post. And then the other component to it, which is a very important, is they had to post their minimal allowable and their maximum allowable based on commercial insurances. So this is the very first time we've been able to peel back the layer and look at a hospital, not just charge. We know hospital charges are high, but they are actual allowable with insurance companies. And so I grew up in Kentucky, and I grew up in a rural part of Kentucky. If you draw a line down the middle part of the state and go east of I-75, which cuts the state in half, it's a massive land area, but there are zero private practice orthopedic surgeons in the entire eastern half of the state,
Wow.
and zero ambulatory surgery centers
Mm-hmm.
in the eastern half of the state. So what that creates is small pockets of monopolies that hospitals control.
Sure.
We knew that numbers were going to come out. Hospitals made a choice whether they were going to comply or not comply with posting these prices. The ones that complied and posted the prices, we were ready for that. We got all of that information, and it became almost like it became very personal pretty fast when you saw how much the hospital was hurting the people who got services in that area. So for me, in my hometown, that hospital system owns all of the specialties. Every single specialty is a employee of the hospital.
Mm-hmm.
And a simple example is a knee injection that cost $70 at my clinic was costing $1,700 or $2,000 at the hospital. And if we started doing the math on that, and then we're talking about, we're in the middle of COVID, families are hurting, something needs to happen from a financial standpoint, and the person who is the company is a champion of employing people in that town is actually killing their own people financially. And so I decided almost instantly, I'm doing something about it. I'm going to be very bold about it, and I'm going to show up and create a ton of enemies, but not care, because it's the right thing to do for the patients.
Right.
And so we literally have mapped out where we're going to put clinics inside of Kentucky. And our plan is very simple: show up, provide 5-star care, post our prices.
Mm.
And essentially, we want to take away the acuity. If your procedure or your orthopedic problem can be taken care of somewhere other than the hospital, then let's do that. Because number one, it's better for your pocketbook. Number two, it's just the typical thing that you get when you have when you're in the city and you're in the Tampa Bay area, there's surgery centers everywhere. There's lower cost care at a higher acuity than there is when you go to the rural areas of Kentucky. So we essentially pitch that we're bringing city orthopedics to the country. In
Mm,
order for us to be able to do that, the key component without question was telemedicine. Like, it played a key role because now I can spread myself between two states in a way that I could never do that before, because I
right.
can't be in Kentucky, seeing patients on Tuesday and be in Tampa operating on Wednesday. It's
Yeah.
not possible.
So tell me how
So
it works then right now with you being in Kentucky.
yeah, so we're not. So the brick and mortar part of it in Kentucky is not open yet. So we're working on a lease. We have the business plan in place. We're actually interviewing physicians to
Mhm.
become. So the plan is we'll find a physician who wants to live in that particular town. And let's just say, well, let's not say any names right now, but let's say it's a town in Kentucky,
Uh-huh.
and we're looking for someone who wants to integrate into that small town and live there, raise their family there, and they'll become the staple of our OrthoLinks footprint
Mhm.
in that particular town. And then we're also doing that in triangles, so 3 different towns. Now, what changes is this is a complete change in the model of how orthopedic care is delivered. Because previously, if you lived in one of those rural towns, if you wanted specialized orthopedic care, you traveled to the city.
Mhm.
So you go to Lexington, you go to Louisville, Cincinnati. We're
Louisville.
flipping that model and bringing the surgeons to the small towns. And
Mhm.
so the surgeons will live wherever they want to live inside the state, but we're literally flipping the model and bringing them to the people in the small towns and meeting them at that clinic. But that's only possible by integrating telemedicine and allowing the surgeon to see multiple people in multiple small towns at the same time. So during a day, we may see 5, 6, 7 people from 5, 6, 7 different towns in Kentucky, and then coordinate their surgical care if it's indicated on the days that we're in that particular town. So by doing that, we free the surgeon to be mobile and live wherever the surgeon wants to live. Because to be honest with you, one of the issues is to hire very talented orthopedic surgeons. A lot of them don't want to live in these small towns, like they
Mhm.
want to live in the city. And so it really opens up our ability to hire very talented surgeons and still bring them to people versus say we have our office here, you have to come and see us. So it helps both people. It provides our service to the patients, but then also allows them to stay closer to home. And we're going to do that in a pretty innovative way. We're going to have an RV with an office in the back of it set up with telemedicine. And, if the surgeon has to be in a certain town in a certain period of time, they're going to have a driver show up, come pick them up. They'll work on the way there and work on the way back. And it's
I
going to
love
be
it. You're
a
gonna be
way that we can
mobile.
use. Yeah,
Mobile
it's very
orthopedic
mobile. It's like
surgery.
a,
Mhm.
yeah, I mean, we obviously have to have a brick and mortar place to do the surgery, and but other than that, it's going to be like we're coming to you and we're bringing talented people to you in a way that you've never had before at a price that's almost like 1/10 of the price that you currently pay for the service that you have.
So let me ask you a question. How has telehealth changed you and your practice?
I think for me, it's done good things and bad things. The good things is it has allowed me to
Open up in
keep
Kentucky?
it for sure, no doubt. That's what I was going to say. It opens me up to a business model that was never in my mindset. Like we never would be able to pull it off without telemedicine. The bad thing it's done is I'm a people person. I like looking people in the eye and seeing people as well. So it's been a transition for me to say, I'm going to see you on the phone. But I mean, we live there right now. So it's just me being hard headed,
Mhm.
thinking like I need to see you across the room. And there's an appropriate time for that actually. And that's never going to go away. But there's also sometimes where it's like, I would rather see you on my lunch hour at work than drive to Fletcher Avenue at lunchtime.
Right.
And so it's a huge advantage for patients too. And I think we let the patients drive that decision rather than let the physicians drive it. And if you need to see me, then we'll figure that out. If
Well,
telemedicine is
you don't
good
have
for
a
you.
choice anymore. I'm going to interrupt you right now. I'm going to do that a lot. You might be from Kentucky, but I'm from New York, right? This is the battle of since our relationship began a few years ago. Um, there, the patient demand is all that matters. Consumer demand is driving business everywhere. So
Yeah.
it doesn't even, no matter what anybody thinks out there, as a physician, a practice owner, somebody that's looking to open up new locations, the patient has gotten real comfortable with what we're doing right now, which is over Zoom, right? So
Yeah, for
we really
sure.
we have to mold to what the market dictates, not what we think is a good idea. So I'm so glad your stubborn head decided to make that move. I
Well,
must have been a shift for everybody around you.
I don't think so. I mean, you get the same me, but
Oh, I
it's a
don't know.
change in the.
I'm not saying that I know they're getting the same you. There's an impossible way of you to change that. But you being able to adapt to doing
Sure. Yeah.
something different, is sometimes the hardest thing for
Yeah, for sure. I think people who don't adapt are going to get left behind. There's no question. If
sure.
you try to do it the traditional way, you're going to lose business.
You are going to lose. So I want to talk about that insurance thing because I'm a huge fan of what you are doing with being very transparent with what you charge as an orthopedic surgeon and listing your prices. That's in the works for you right now, where that fee schedule is going to be appropriately positioned, I assume, somewhere on your website and all of your social media. So talk us through that.
Yeah, we made a decision to go from um, this mystery that happens when you break your ankle or you have shoulder pain, and you have this insurance card, and on your insurance card you'll find a copay. That's about it, that you'll find on your insurance card. So you're hoping that this shoulder pain doesn't bankrupt you, but you're not sure if it may or may not bankrupt you based on what your perception of what if you have to have a surgery, if you need an injection. So we made a decision that to correlate with the hospitals posting their prices, why don't we require physicians to post their prices as well? And there's no legal requirement for that currently. We're trying to lead the charge and really put the power back into the patient's hands and say, this is the maximum amount that you're going to be charged if you see us. It
Mhm.
may be less than that if your insurance contract for your discount for your insurance is, let's say, United Healthcare versus Aetna versus Blue Cross. There may be a different price, but there's no question that this is the maximum amount that you would be charged out of your pocket. Um, we're in a place now that deductibles are huge, 5,000, 7,000, $10,000 deductibles. And all that means is you don't have insurance until you meet your deductible. And the
Right.
only thing you've done, and it's not your fault, it's usually the employer's plan or the insurance that you get, you've allowed an insurance company and a physician group or physician to negotiate your prices without your input. Because if I'm a great negotiator, I'm able to go to United Healthcare, get a great contract from them for whatever reason, whatever my negotiating point is. You have no control over that. You just came to a place that was a great negotiator, and you're going to pay more for my services than you would pay for someone else's services. So we're going to put our foot on the accelerator and literally pressure the patients to pressure the physicians to post their prices.
So let's
Just
talk
like a,
just for a minute for the patient and for the employee. So through this pandemic, I've had a lot of friends and colleagues reach out to me um, about some of the same issues surrounding where they are with their jobs. So a lot of people, as you can imagine, are very unhappy in their jobs. But one of the main reasons that people stay in their jobs today is because of their health insurance benefits. So that conversation has been I can't leave. I'm miserable. This is a toxic environment because I need these employee health benefits. And so I've been talking to them more so about, catastrophic plans, just in case that huge thing happens. But most of it is like, what if I get into a car wreck and I need surgery? They just, in their minds, they're like, oh, that's $600,000 and I'm never going to be able to pay that. So that is a real advantage today for people to know that there are surgeons like you, who you'll be the only one, I'm sure, for a long time, that has the courage and the empathy to be able to post that because you've never been about the price. You've always been about you're going to do the surgery if the patient actually needs it, which is not what everybody thinks an orthopedic surgeon does. We've had this talk many times. You
sure.
just want to line people up and cut into them. That's
Yeah,
actually
yeah,
not true.
I mean, that's a perception that's real though.
It is very real. So I think it's great. I think that people need to know that this transparency is going to be so helpful, because I do think people have a very irrational sense of what something should cost.
I'll
So,
just give an example. We just had a patient who doesn't have insurance
mhm,
and had a broken bone, and in their brain thought it doesn't matter what the outcome is. There's no chance I'm going to be able to afford the surgery. So just do whatever you need to do. Let me go home and be crippled,
right,
and because I don't want to be financially crippled
right.
by this particular situation. And I I'm bold enough to open the conversation like, hey, are you just acting weird because you don't think you can afford it, or is it because what's going on? Because it's not typically how we deal with this issue. And they literally said like, I thought it was going to be like 50,000, and
Mhm.
I don't have $50,000 because the reason we think that is because that is reality in some parts of the world. Like we
Absolutely.
start talking about, let's pick on East Kentucky again. The same surgery that I do for $4,000 may cost $25,000 at a hospital in
Mhm.
Kentucky, and it's just insane. I mean, it makes no sense.
Yeah.
And so having that out now, there's three components to a orthopedic surgery endeavor. One of them is the professional fee, which is what I get paid. The other is a facility fee. So the where we do the surgery, that's typically the largest of the cost. And then there's an anesthesia fee. So for the anesthesiologist or CRNA. So that's the other thing that we're going to really push on. We're going to do our surgeries
Tell us
in
what
places.
RNA is, Doc, for the average Joe that might be listening that doesn't understand what that
Yeah, it's a
term
nurse anesthetist. So it's a nurse who's trained to provide anesthesia services.
is. Thank you.
So we're going to start operating at places that are willing to also post their prices. So you have the full Monty, every penny that you could potentially have to spend. And if those surgery centers don't want to do that, then they're not going to get our business. We're only going to go to places that are going to be open to posting their prices. And if there's some nasty secret and some big contract they don't want to disclose, then they'll have to find another surgeon to operate there. So
Hmm.
we're going to be, I want everyone to know almost to a penny how much it's going to cost for this endeavor. And then you can become an informed consumer. You can make your own decisions. If you still decide that your knee doesn't hurt $10,000 worth of pain, then that's okay. You were informed.
Mhm.
If it's because you thought it was going to be $100,000 and that's not okay. But that's the current environment we live in. It's a gamble. You show up, and then the medical debt is crippling in this country. Like we're in the United States, and medical debt ruins people's lives like
Oh my
crazy.
God. I just watched 60 Minutes Sunday night, and it was about, it's devastating, right? To think of all the people that have been lost, over 400,000 people. And one story in particular was about a woman who had been proposed to on a cruise ship, very excited in 2019. And then 2020, her fiance died. And so that's horrible. And then to have a funeral where nobody can go to and it's all virtual, horrible. And then she gets the medical bills, for her husband, her fiance. And, she doesn't have that kind of money. So all of it is like, it's just bad on top of bad. And I think the transparency
So,
thing is so needed. As we mentioned before, this is a consumer demand type of world that we are now in. And we, as the patients, are going to drive the physicians and the surgeons to be more transparent. But, you
well,
being
well, I think there's another side of that I'm finding out as well, which is there's a subset of patients that really don't care.
Hmm.
They have a deductible that gets met very early. Let's say they're on an expensive infusion or something that happens. Their deductible's met during the first month of the year in January. Then after that, they really don't care what the price is because someone else is paying it. But the problem with that is insurance deductibles are going to get higher. Insurance premiums are going to get higher. Someone's paying for it. It's not that you just swipe your insurance card and then the price just magically disappeared. And so we have to change the mindset. And those people who have, let's call it what was called before, a Cadillac plan,
That's my
and
My husband,
and
yes, ma'am, we have that plan.
yeah, so but we have to change the mindset of like, oh well, insurance just takes care of it because that's true. And then what's going to come is all the Cadillac plans are going to become Camry plans, and all the Camry plans are going to become Pinto plans, and then we're going to be in big trouble.
Do they even make Pintos anymore? I always
I
say
don't think
Pinto.
so. I'm gonna search eBay and Craigslist for one though, because I keep saying Pinto in all the
Me too.
interviews. So
That's so funny. I always say Pinto, but that's just showing, our age range because I haven't seen a Pinto. When was the last time you saw a Pinto?
I probably have never seen a Pinto. But
That's how bad of a brand Pinto has. Poor Pinto.
yeah,
We should
we're
bring
gonna
it.
bring it back. We're
Yeah,
gonna bring it back.
that should be the RV. It should be a Pinto.
Well, no doubt, and I think that they need to get on board with that too and start producing some RVs fast.
Sponsor. Pinto brand should sponsor the RV.
Yeah, for sure. I'm afraid they'll think it's pinto beans though. It's a different it's a different deal.
Well, Dr. Hunt, I'm really excited about what you're doing. I'm definitely going to reach out to schedule something to come in and do a little tour of your
Sure.
St. Pete location. I don't have a plan right now to go to Kentucky, but when you are open in Kentucky, I know, I do. You've seen my stepson sporting his Kentucky all the time. His mom.
Well, all I know is I just see all these posts about please take me to Tennessee, please take me to Tennessee, and
Oh, I do love.
Kentucky's just a little bit better than Tennessee.
Is it
Yeah,
really?
really.
My views were fantastic in Tennessee. No, I know. Listen, everything has changed because of this pandemic. The only thing I think about more than, maybe my Starbucks coffee every day is those mountains that I was able to see every day in Tennessee and that peace of mind that it brought. So, all right, maybe
Yeah.
one day we'll see. Well, Dr. Hunt, thank you so much for joining us today. I can't wait to see those transparent prices being posted on your
Yeah,
site.
they're
You'll keep
coming
us
very soon
informed when they're available. I'm looking forward.
for sure.
Thanks, Doc.
All right, thanks for having me.
So don't forget, if you mention that you have seen the show or listened to the podcast, Thai Technology, 3 months for free.